There will be times when we feel in the dark, when a patient's symptoms don't follow a familiar pattern and we just don't have the answers the patient needs. This is Jason and his mum, Marjorie. The staff at the medical centre know him well because this is his 4th visit in just a few months. Jason loves his football and is the school team's captain. But now he's suffering from a sore back, stiff joints and shortness of breath. He's showing dark spots on his sclera. His earwax is black, the cartilage in his ears is dark and thickened, and his urine is dark brown. This is not a combination of symptoms Jason's GP is familiar with, and she is struggling to reach a diagnosis. Jason is suffering from what is classed as a rare condition. A condition is considered rare when it affects fewer than 1 in 2,000 people. But having a rare condition is not rare at all. In fact, 1 in 17 of us will be affected by a rare condition at some point in our lives. That's nearly 500,000 people in Scotland alone. And that's because there are over 7,000 rare conditions, with new ones being identified all the time. It isn't possible to know every single rare condition, and it can often take many years and many investigations to arrive at a diagnosis, a process known as the diagnostic odyssey. So what should Jason's GP do? First of all, it's important to be honest and acknowledge that she simply doesn't know. She needs to think carefully about the wider picture, seeing rare conditions as clusters of symptoms that affect different systems. She needs to look closely at Jason's previous appointments and medical record, finding out what she can about his family history. And given that 8 out of 10 rare conditions are genetic, it's particularly important for her to make a referral to clinical genetics. And this is how she's finally able to provide a diagnosis of alkaptonuria, a genetic condition caused by the buildup of a protein called homogentic acid. Now she's able to coordinate Jason's care across a range of different health professionals, providing holistic care for him and his family. She also signposts them towards other sources of support and information, and ensures Jason's school has everything it needs to support his education. Jason's experience can also contribute to clinical research into his condition, adding to our understanding of the long-term outlook, as well as giving him access to any new forms of treatment. But sometimes it's the patients themselves who are the experts, and they and their carers may have all the answers you need. This is Sean, a clinician working a particularly busy night shift in an emergency department. This is Nadia, who's 5 months pregnant and suffering flu-like symptoms including acute headaches, weakness, nausea and vomiting. She is also showing signs of confusion and speech abnormalities. This isn't a combination of symptoms that Sean has seen before, and he's unsure how to proceed. But all he has to do is listen. Nadia tells him she has thrombotic thrombocytopenic purpura, or TTP, a rare blood disease, the cause of which is still unknown. She needs specialist treatment, including a plasma exchange, and shows Sean her care summary that also tells him who to contact for specialist help. Shortly afterwards, Nadia's blood results come through and are consistent with the TTP diagnosis. Sean contacts a specialist in her care plan and is able to authorise the care she needs. He is also briefed on the additional risks her condition brings to pregnancy, so he's able to bring in other specialists to ensure she and her baby are kept safe. It's always important to be aware of sources of support for both yourself and your patients. Scotland's Rare Disease Action Plan has been put in place to help raise awareness of rare conditions, achieve faster diagnoses, improve the coordination of care and access to specialist care, treatment, drugs and information, such as NHS Inform, which provides links to NHS services dedicated to supporting those with rare conditions, including specialist clinical networks and CARDRIS, the Congenital Conditions and Rare Diseases Registration and Information Service for Scotland. Scotland's 4 regional genetic centres in Glasgow, Aberdeen, Dundee and Edinburgh also provides specialist expertise, along with many other organisations across the UK. Rare conditions pose a unique challenge for healthcare professionals. Although many are genetic, some are not and can present later in life affecting multiple systems. But it's a challenge we do not have to face alone. The NHS is committed to improving the care we provide, and if we work together, share what we know and support one another, we can bring about real improvements to the lives of the people living with rare conditions and their families across Scotland.